Health Minister Stephen Donnelly, good morning.
Good morning, Shane.
Minister, you were on the show talking to Ciara a week ago, and you said at that point that the government was not actively considering a full return to working from home policy. You were cautious about rolling out the boosters any faster than they were. Like, everyone could see that what way the figures were going at that point. Are you behind the curve? Or is this government constantly behind the curve when it comes to fighting COVID?
We got new modelling on Monday, Shane. We got it around lunchtime on Monday. It was very different to anything we had seen before. And we had to act on it. So what we did was we convened as a COVID committee and then made a decision at Cabinet the next morning to act. So it will have come as a surprise to some people. There's no question this is a change. But I think one of the things that serves us very well in COVID is a government that can look at new information quickly and make changes accordingly. And that's what we've done.
Okay, I have to put it to you again though. It was pretty obvious last week, and NEFIT were suggesting it, that the figures were such that return to working from home policy seemed pretty inevitable. You were kind of slow about realising that.
I wouldn't agree with that, Shane, at all. We had public advice. We had modelling that said that the curve was going, or that the cases were likely to peak in the second, third, or maybe last week of November. That's what we were working towards. As soon as we saw the new modelling, then we changed. Literally within hours, we were making new decisions, and I think that's what people want to see.
Okay, what about antigen testing? You have been incredibly slow as a government to embrace antigen testing. Is that because NEFIT have been very reluctant to do so?
Well, as you know, I've been embracing antigen testing for quite some time. I set up the original expert group, and then I set up the group led by Professor Mary Horgan to make sure that if we came to a situation like we are in now, that we could widely deploy.
It's a pretty watery embrace, Minister, with all due respect.
Well, not for me, it's not. I've been very strongly advocating it right from the start, set up the groups. And what we've done now, of course,
did we take the advice from those groups? Because they were, the Ferguson report, I think it was, wasn't it? They sort of advocate. We haven't really been using them. And it's been caution from NEFIT all the time about the impact of them.
It's been caution from NEFIT on how they're used, and indeed there was a clinician on Newstalk this morning who said exactly this, that he was very concerned.
Dennis McCauley.
Dennis McCauley, that he was concerned about the way people were using them. They were using them in the wrong way, and NEFIT have voiced that right from the start. However, I think it's very important, Shane, to say when it comes to antigen testing, they are being used widely. So today, thousands and thousands of tests, boxes of tests, will be sent out to households all over Ireland by the HSE. They're being used in early childcare, they're being used in third level education, they're being used in serial testing in nursing homes, they're being used in a lot of workplaces, and they're being used obviously for close contacts. And on top of that, you can buy them in many shops, many pharmacies, many petrol stations.
I bought a box the other day myself. I think I paid it was for a box of 5. I think it worked out a bit. I think it was €35. I think it was €7 each. Like, they're pretty pricey. There is talk about them being subsidised. When is that going to happen? What will the subsidy be?
Well, first of all, most importantly, they're being given, boxes of 5 are being sent out for free to anybody who's a close contact, and that's very, very important. There's 2 things that I want us to see go further on. They are now being widely used. They are widely available. The HSE has the materials on how to use them on the website. So all of that has been done. But there's 2 additional things that I want to see happen very quickly. Number 1 is that the price for the general public comes down to a few euro. As you said, it is too expensive.
So what we're talking €3? Is that the most likely cost?
I can't get into that just now because of reasons of commercial sensitivity, but we'll be able to clarify that very shortly. But then secondly, Shane, as to the conversation you had with Dennis this morning, we need stronger public communications about how to use them and how not to use them.
Okay. Is there an argument for giving them away free? I think they do that in the UK, don't they?
They did do it for free in the UK. They came under huge criticism for Parliament for the way it was done, and the UK is now stepping back from that position.
Reports today in the paper that there's a resistance from your own department. I'm not suggesting you, but from officials to your own department, to the idea of subsidising the antigen test. Why is there resistance, and what's the nature of that resistance? Is it budgetary?
Well, obviously concerns would always be raised with me, as is right and proper by a department. One concern that would be raised would be the price. So it could, for example, cost several €100 million to roll these out at a subsidised level. Nonetheless, I believe it's important, government believes it's important, and therefore that's what we're going to do.
Okay, when?
Very shortly. As I said, the final details are being worked through at the moment.
Are we talking weeks or months or
days?
No,
we're not. No, we're not talking weeks or months at all.
Okay, within a week, possibly.
Yeah, I'd love to be able to give you a date, Shane. I can't. What I can say at this point is that it will be very shortly.
Yeah, but we're in the eye of the storm. We kind of need these soon, don't we?
Well, we have them. This is the important thing to say. All we're talking about now is reducing the price. They're widely available. The supporting materials are available on the HSE website, and they're being sent to thousands of homes for free all around the country every single day. So antigen testing is now an active part of our fight against COVID.